Thank you for joining me for this short presentation that reviews the Medigap, Medicare Supplement, Plan F versus Plan G. My name is Kim Caldwell from PBI Insurance, and I am here alongside my colleague, Fanny Pacheco. Combined, Fanny and I bring over 20 years of experience in the Medicare field, and at PBII, our primary focus is on Medicare products and how they can best work for you. In today's presentation, we are going to break down the difference between Medicare Supplement, Medigap, F versus G plans, and potentially why the G plan over the F plan is applicable. After 2020, Medicare eligible members no longer have the option of joining an F plan. So for the most part, this presentation will be for existing Medicare Supplement F plan holders, F as in Frank. The reason the G plan is being discussed as potentially the plan of choice is twofold. First, the G plan is showing up as a better value than the F plan. And second, more carriers are offering G plans, which means there's more competition for your business, and that translates into lower monthly premiums. The Medicare Access and CHIP Reauthorization Act of 2015, MACRA, brought about changes that affected Medicare supplement plans, including Plan F. The new law prohibits newly eligible Medicare beneficiary, those who turn 65 on or after January 1st, 2020, from enrolling in the Plan F or Plan C. This means that the pool of Medicare eligible members that have the Plan F is getting smaller and older, which makes the underwriting of these plans more difficult to predict, and as a result, these plans are seeing dramatic price increases. So let's begin by reiterating that every Medigap or Medicare supplement policy must follow federal and state laws designed to protect you, the consumer of these policies. Insurance companies can sell you only a standardized policy identified by letters. All policies offer the same basic benefits. There are some that offer additional benefits such as hearing aids or vision benefits, but even that additional benefit has been added by most top carriers. This means that no matter what insurance carrier you choose to go through for your Medicare supplement plan, the doctors will continue to accept your plan regardless of the insurance carrier your policy is through. On a Medicare supplement, Medicare pays first. So if you have a service that is medically necessary per your doctor, and your doctor accepts Medicare assignment, your Medicare supplement plan is obliged to pay second. Switching insurance carriers has absolutely no impact on your doctors. If your current doctor is using your, as an example, Blue Shield Medicare supplement policy, then they will also accept any other insurance carrier who offers a Medicare supplement. United Healthcare, Anthem, Humana, HealthNet, etc. So what is the difference? The difference is $226 in 2023. What does the $226 represent? It represents the 2023 Part B annual deductible. This is the only difference between Plan F and Plan G. On Plan F, you would go to the doctor and pay nothing out of pocket for anything medically necessary approved by your provider who accepts Medicare assignment. All you would be responsible for is paying your plan monthly premium to that insurance carrier. On Plan G, you would go to the doctor and be responsible for the first $226 of costs of your service per year. This resets January 1st of each year. But after that deductible of $226, you will pay nothing out of pocket for anything medically necessary approved by your provider who accepts Medicare assignment. You are also still responsible for paying your monthly plan premium to your insurance carrier. This is a snapshot of the plan benefits side by side. After the deductible is met, Plan G benefits are the same as Plan F. Plan F benefits include coverage for all co-pays, deductibles, and coinsurance. This is the type of snapshot you are going to see in any insurance carrier's Medicare supplement booklet. Let's do a quick comparison of premiums and coverage, Plan F versus G. These numbers are not actual, just an example. Mr. Jones is on Plan F with a company that charges $3,540 in annual premium. That is around $295 per month. Mr. Jones is looking at Plan G with a company that has an annual premium of $2,412. That is around $201 per month. So including the difference with Plan G, where Mr. Jones must pay the Medicare Part B premium of $226, the total cost of Plan G is $2,638. This is a savings annually of $907. In this case, a pretty significant amount. Perhaps your mathematics, when we do a comparison for you, comes to a savings of $100 annually, $200, $500, over $1,000. You are going to make the decision to switch if you think it's worth it for you. But in the end, why pay more for the same benefits? So if the costs of the annual premiums under Plan G are lower than Plan F after you factor in the $226 deductible, why would you not go with Plan G? I honestly don't know, but any question is a good question. And these are some of the reasons we've received from our clients. One reason is that Plan G is considered a lower level plan than Plan F. So if you wanted to move back to a Plan F after you had switched to a G, you would not be able to do that. Perhaps another reason is because the Part B deductible could increase. Very valid. However, as an example, in 2018, 5 years ago, the Part B deductible was $183. So over a 5-year period, this deductible has increased by $43, less than $10 per year. You may also have not had a G plan recommended to you because you have an agent who works for an insurance carrier who doesn't offer a G plan. Some insurance carriers have chosen not to do it. Now, however, since 2020, the G plan has become a lot more accessible to agents and brokers and insurance companies. The other thing that I think requires a bit of full disclosure is that when we switch you to a lower premium plan, as a broker, as an agent, we actually receive less in commissions. So potentially the agent or broker that you're working with doesn't want to make that switch. First of all, it does take a lot of effort on all of our parts. We have to fill out a new application, etc. But in addition, that agent or broker will receive less commissions for you as a client. And as a business person, potentially that might not be the direction to go. As PBI Insurance, all we do is Medicare. We understand that the best thing that we can do is make sure that you're getting the best value for the Medicare Supplement or Medigap plan that you are on. Another question that comes up and we thought we would address with this F versus G conversation is, why is the G plan better value than the F plan? Some possible answers to this are that it does cost money for the insurance carriers to administer paying that Part B deductible for you. So the Plan F premium not only adds in the deductible, it also adds in a premium to manage and pay the deductible for you. Also, F plans have been incredibly popular, and they have guaranteed issue and have the most comprehensive benefits that is not paying for the deductible. This larger population of individuals on the plan can make it susceptible to rate increases. We hope that you enjoyed today's presentation. We are absolutely available from an email or phone standpoint to help you with any questions that you might have about Plan F versus G or anything Medicare related. But please don't hesitate to reach out, and thank you so much for your time.